A very good morning. Thank you so much for staying with us. You are still watching the Morning Breeze, our segment of the breakfast meeting. My name is Doreen Komhanj, and yes, it's a Monday, it's a new week, and it comes with plenty of events and, of course, plenty of actions that are to be taken this week. Now, still this week, we'll be talking about health, as tomorrow marks the Universal Health Coverage Day, yet again to happen here in Uganda, but it's global, of course, and our center of discussion will actually be on that. So we will definitely be looking at assessing universal health coverage in Uganda, how far we've gone. And of course, there was a roadmap that was drawn. We'll also be looking at how we've been able to walk the talk and, of course, whether or not we've been able to implement one or two things that we felt would actually enable Ugandans to reach, because universal health coverage is actually looking at, child care, we're looking at maternal health, amongst others. So we'll be looking at what exactly has been put in place to ensure that we actually get to attain this. And now we are talking about investment in Africa's health systems that happens to be vital if the continent is to achieve inclusive and sustainable growth. So question is, what exactly has Uganda put in place to ensure that we have a success story at the end of the day? Joining me in studio is Dr. Patrick Tumusime Kagulusi, the Program Manager, Amnet Health Africa in Uganda, and Dr. Patrick Kadama, Director Policy and Strategy. Good morning, doctors. How are you?
Good morning.
Thank you for joining us this morning.
Thank you.
So the Universal Health Coverage Day is here, happening tomorrow, the 12th of December. How would you first of all assess universal health coverage in Uganda?
Universal health coverage in Uganda has been assessed by what is called the SPEED project. This is the most recent assessment that I've come across. And while there is some progress, nominal progress, we are far from moving towards putting in place the set of policies and interventions that would ensure access to quality, affordable health services. And services in the broadest sense, in that it's not only clinical care services. That report looked very much at personal clinical services.
Okay.
There are public health services, services that are not necessarily delivered by the health sector, services that are necessary for people to live a healthy and in a good state of well-being outside of the health sector, in their homes, in the places of their work, and in the places that conveys them to work and from work.
Okay. All right. So when we talk about universal health coverage, what should we focus on?
Universal health care coverage is really about undeterred access to the clinical services that have been mentioned, health information, ensuring that medicines and supplies are available, ensuring that you have access to a health worker when you need one, ensure that you are even protected from diseases, and most importantly, you're not driven into financial catastrophe because you wanted to get health care. Everybody in this country knows that there's a lot of cost related to health. And because health coverage or health care is not accessible either freely or at an affordable cost, many people are driven into poverty because they've tried to access health care. Good examples include people who have to go to India, for example, to get kidney transplants, liver transplants. That is the high end. But every time there are many families in Uganda, about 1.5 million people are at risk of financial catastrophe because they are going to get treatment for such simple things as malaria, getting a delivery, somebody has to sell a goat. So the issue of universal health care is about getting the service, getting the information, having the health worker, having medicines, and not falling into poverty or financial catastrophe because you wanted to access or you went to access a health service.
All right, so as we speak today, and I'll bring it down to Uganda actually, the UN, the United Nations, has called on all member states to actually adopt the universal health coverage, a system in place. And as we do speak, it's also been included in the new Global Sustainable Development Goals.
Yeah.
And as a member country, what is expected of Uganda?
Uganda is expected to have favorable legislation that allows for universal health care coverage to happen. Uganda is expected to have in place a system that provides sufficient financing for health. The public sector and government is not yet able, for example, to provide the amount of money that is required. We've signed up to the Abuja Declaration. We are supposed to have at least 15% of our GDP going to health. We are doing, I think, around 6.3 right now. So we are very far from that. So we need to put the financing, we need to put the legislation. We do not have enough health workers. And recent events also point to that even the ones we have, we still have challenges in maintaining them. So we expected to have in place sufficient numbers of health workers, with sufficient skills, with sufficient tools and equipment to provide health services. We are supposed to have sufficient health supplies and medicines, but also to go to really the basic minimum. Every household needs to be able to get the correct information, to put in place preventive mechanisms to prevent themselves from getting ill. So, and in a way that we can afford, at least we should have community health workers who are resourced, who are remunerated, so that they also have their responsibility and you can hold them accountable for ensuring that the communities are healthy.
All right.
So those are some of the things that we need to have in place.
Yeah. What else do we need, a doctor, to have in place to ensure that as a member country, we adhere to the call by the United Nations to actually talk about inclusive access to health care services in the country?
First, I think first and foremost is understanding the concept.
Yeah.
Understanding the concept is key to getting it right. What universal health coverage is, it is a set of policy interventions to ensure quality, affordable access by all. Now, the level of care does not matter. The level of the services is not the issue. The second thing about universal health coverage, it is not a means to an end. It is an instrument to ensure the least gap between the have and the have-nots. It is a mechanism to manage equity, the inequality in health outcomes in a given society. So in every given society, we have people who have better health outcomes than others. And what universal health coverage instrument is supposed to do is to ensure that that gap is narrower.
Bridging the gap, yeah.
It's not to make sure that we are like United States, no. It's to ensure that at whatever level we are at, the gap between those who are better off and those who are called poorer narrows.
Okay.
It is to manage the disparity in health outcomes.
All right.
Given the same conditions. So supposing we all live in Uganda, we live on $1 a day, there we should have a smaller gap between those who have and those who
And
don't
the
have.
have-nots.
It is to manage inequality at any given level.
All right,
That is the first part.
No, that's the purpose of universal health, coverage. But what's the picture in Uganda? You are doctors, you are in the health, care system. You know what is happening. Could you paint it for us?
Well, I just mentioned it to you that
In
there has been,
regards,
yes.
in response to what is expected of the country.
Yes.
Yeah.
And that's what I'm saying, that there's been an assessment of this. Unfortunately, we don't have the Ministry of Health, we don't have government here, so I'll not speak for them.
Yeah.
What I can say is that, for instance, recent reports indicate that the gap between the poor and the rich is widening. 4 million people have gone into poverty in the recent past. Maybe you've had, maybe you have not had. And as I said, the policy interventions to be put in place are not necessarily in the health system. Some of them are outside. What people live in their houses, people work in their places of work, and we want them healthy. That is what universal health coverage is. It's about keeping everybody healthy in their place of work, in the place they live, and those that fall out of the stream of good life, to ensure that there are mechanisms to care for
All
them.
right. So, what areas in Uganda do you think need prioritization?
There are areas that Uganda is definitely focusing on.
Yeah.
One is young people. Uganda has about 75% of the population
Yeah.
who are youthful. So young people and adolescents need to be taken care of, because that's, in order to harness the demographic dividend, their productivity, you need to make sure that they are going to grow up a healthy generation and a productive generation. The next group is women, definitely,
Okay.
who suffer unprecedented health challenges in this country. You know about the HIV statistics, women suffer it more. There are other conditions like fistula, like maternal death, which will only happen to women. And these days, of course, cancers have also gone up. So those are areas that we need to look at. There are also the children, because of, again, we are a very highly fertile population. A woman will have about 7 children in her productive lifetime. And so we are going to have many children being born, and they need to be taken care of in terms of health. So briefly, those are the sectors. Of course, I don't want to leave behind men. They don't need to be forgotten. There are also issues that are coming up for men, especially cancers, injuries, occupational hazards. All those are areas that we need to focus on. But most importantly, the youth.
All right.
Yeah.
So we have in Uganda right here, in response to the universal health coverage goal, Uganda also designed the health sector development plan. That's 2016-2020. Has it been able to? Is it working us towards bridging this gap that Dr. actually earlier referred to?
This is a question you have come back again.
The plan that we have in place,
the evidence
yeah.
in place
Yeah.
is that the gap is widening. The goal of universal health is to narrow the gap.
Yes.
So if the gap is widening, we are not doing a good job.
But we do have a plan.
We do have a plan.
Yes.
You're asking whether it is responding. I'm saying that the recent assessments are showing
It
a
says
gap
no,
and so
yeah.
that is answered. What we need to be revisiting now is how can we put in place those policies, reform them to ensure that we move towards everybody not being left behind, ensuring access, quality access to services that they require, particularly public health services, but also in terms of personal health services, good quality services, in clinical services, clinical health outlets.
But with the health sector development plan, my assumption would be that as a country we do have the policies.
Yeah, I think Uganda has very good policies,
Yeah.
right? Very good documents, and a lot of brain work goes into this. But the implementation is where we fall short. And so, but I wanted to bring to light, for example, the National Health Insurance Bill, for example.
Yeah.
It's one thing that would be very useful for Uganda. It's a policy that if it were in place, everybody would start moving towards health insurance, and they would get even additional financing to our health sector, our health services. But this is something that Uganda has told about. It's somewhere maybe in Parliament, but it's not getting the attention it's supposed to get. But if we want to move to universal health care coverage, I think we need to get alternative financing, and we need to get people contributing, because indeed we've shown that the public sector cannot raise the money that we need. So the individuals, instead of paying out of pocket from under the tables or through getting alternative services, national health insurance is one way to go to ensure that we have universal health care coverage.
Does this begin and end with government, or should we also focus on the private sector, for example?
I think the private sector has already shown that national health insurance, health insurance works. They ensure their workers, and the workers do not have to suffer any financial burden. And yes, actually, they are the workers who are contributing, but the private sector has organized it. So these are lessons that are here with us that we can learn. And I think it's long overdue for the public sector to take it up.
All right. So let's get it off the high end and bring it down to the common person, the person that is watching right now. What important roles do you think community health workers can play towards achieving universal health coverage?
Community health workers are a set of cadres with a set of skills. They are health workers. If you drop the word community and you talk about health workers, we are probably more in touch. What our people require is a set of health workers that are available and accessible to all households at all times and in their stages of life cycle. And it will be important that we have all groups of cadres, particularly in the public health area where we are not doing well.
Okay.
The services that support you in your house, the services that support you at work, the services that support you when you are traveling to work. These are services that we are not doing very well about. But in addition to that, we have the huge burden of infectious diseases, and we are now having a new burden of non-communicable diseases coming in. So we'll need other skills over and beyond the basic skills that sustain your life in your homestead, skills to manage those who actually fall sick and are out. So what will be important is that we have a health worker density that is commensurate with our burden of diseases. We have to work out a ratio of health workers in various categories that can support services that our people require.
All right. So the debate on universal health coverage seems to be in full swing, not just in Uganda. But do you think that you, the health workers, are speaking the same language as the common Ugandan out there?
I would like to imagine so. But somewhere we probably have a gap in how we link up. It is very possible that because we have such a low density, we do not reach out. The density of health workers in Uganda, talking about the performance of the last healthcare plan, health system plan, moving on to the new one, we did not reach the target. I think we had said we'd be able to make it to 1 point. We did not even make that target. And we are in the next dispensation, we are not moving towards the target. So if we do not have a good enough density, we'll not be able to reach out to the population that we require to reach out. And therefore will not speak the same language, or if we speak the same language, we'll not be able to hear one another since the voice will be too weak. The link is still very, very weak.
Isn't this something that you should have focused on perhaps before taking the debate out there, to look at how exactly you can reach the last common person, make them understand universal health coverage, and ensure that they ask the right questions?
Understanding universal health coverage is a leadership issue. It's not the common man.
Okay.
Making policies and rules and regulations that moves you towards managing inequality is why we have leaders in place. So let's not put it on the population. We must
the
understand.
policies have been put in place, like he said. We have the beautiful policies that should
but
actually
they are not
get
being
us
implemented to get us there.
there. Someone has to demand. That
In
they are
1998,
implemented.
it was clearly defined. The rate limiting stage for expansion of primary health care in this country is the availability of health workers. Even if you put up infrastructure in every village, if there are no workers there, you will have no services.
Okay.
We have not managed to capture this. So until we go back to 1998 and correct the distortion that is in our expansion plan for services, we shall not get services to people.
We seem to be having plenty of challenges as a country.
Yes.
We are talking about a goal, a target that has to be achieved by all the member countries, at least as per the call made by the United Nations. How far are we? And how soon can we get there?
In the current situation, we cannot talk about soon. We should be talking about starting.
Okay.
How should we start the implementation? And that's what Dr. Kadama has just been talking about. But I'd like to say that we need the leadership that will take us there, that will have the vision, indeed, not just the vision in books and in the documents, but the vision that puts resources, puts people to start working on achieving this vision. Otherwise, having a plan and putting it in the shelves is not going to help us arrive at universal health care coverage. So at every stage, we need to really revisit this plan and have people getting pieces of it and running with them. Some people, because if you have people who are doing assessments, again, it's almost no action. So the assessment will also always reproduce the same thing. We are not yet there, we're not yet there. The other thing that we need, I think, some disruptive approach, because we can't keep using the same methods and expect different results. We can't keep saying there's no money to invest in health unless we do something about getting that money. And that's why I'm talking about things like national health insurance, getting more resources and investing them in health. And by the way, also dedicating really these funds to improving the health system. Because sometimes the money could come and somehow it evaporates and never gets to the people who need to get it. I agree with you on the issue of engaging the public, the community. They need to know also their responsibilities. Because you cannot expect, and I think they should already be able to see that the process of providing services is not succeeding. So they need to contribute. They need to demand so that the health system and the members of the public meet somewhere at a common point, and that's when we shall have that kind of engagement.
All right.
The community needs also to be sensitized. They need to know what is they are entitled to, or what they deserve, or what they need to have.
Right questions, yeah.
Otherwise, they will remain the way they are. They're not asking any questions.
But do you see, actually, I was going to ask you that, are they asking questions? Do we even seem to know what to ask as the community?
I'm a health worker, but I wish the attention that is given to, for example, the current constitutional amendment, just half of it, I wish it would be given to healthcare. And the people who are communicating issues on this constitutional amendment are the same people who represent the community. So at that highest level, if that attention could just be given to health, even for 1 month, I think we would jump many hurdles in terms of
but while health care is considered a public good, it's a basic human right for each and every one of us. Can we say that its provision, its delivery is an exclusive responsibility of government? Because we seem to be referring to government here. Yes, you talked about the private sector, but again, it begins and ends with the government, like Doctor here put it. So can we assume that we should go back to government Ethiambe, government this, government that?
I think government, by virtue of its constitution, or the virtue of being government, has the responsibility of delivering social services.
But is it exclusive?
No, it's not exclusive. But where we are going, and even in developed countries, healthcare and health services have been almost taken care of by the private sector. Uganda still has about maybe 60 or so percent health facilities, for example, is in charge of policy. But eventually, the investment in health, and then, of course, the provision, if you want to achieve universal health care, it's going to have to go private. It's going to have to go private, and the government will be just a regulator or also contributing something. But most of it private, and also the individual have to be responsible.
All right. Doctor, what do you think that the private commercial sector could offer to the public in this case, as we work towards achieving this?
The private sector gives a great contribution to health and health services. We must understand, health is a product made out there in the household. It's not in the hospitals. Yeah. And well-being is a product personal to hold you and wherever you are. So these are delivered privately in your households and so on. The private sector only needs the instruments and policies in place to enable. The role of government is to put in place an enabling services that ensures access by all to quality, affordable services. It is not to provide them. And where you do not have the infrastructure for them to be provided, then government needs to step in and provide them. Yes, that's true. But the primary role of government is to put in place an enabling service for that to happen. Now, at the stage we are at, our infrastructure, both social and commercial and so on, and in the private sector, is such that it's not able to meet all the challenges, even if enabling environment was put in place. We'll need to build it first before we divest some of those responsibilities. So there will be a very big role in countries, particularly in low-resource settings, to have public intervention in order to build the infrastructure, to build the health workforce, to build the supply chain systems to ensure that services are delivered before we slowly have those structures privatized.
Yeah, but you know, you also, I think you are aware of the fact that the private sector, for example, important as it is, you know, with all the contributions it's made, it's profit motivated. And we are talking about inclusive growth. So at the end of the day, how do we ensure that resource allocation, you know, from the private sector does not collide with public good?
It depends on, first of all, it depends on the role that you're giving the private sector and how you organize them to provide this kind of service. And he has already mentioned that the private sector has to, first of all, be built because it's not, what we have in Uganda so far is not large enough to take up such a big responsibility. But it is beginning. For example, there are very small personal clinics, drug shops that are already providing a service, but the quality is still wanting. Yeah. But they are all over the place. We have those like herbalists or traditional healers. They're trying to do something, but the quality has to be checked and to see whether it actually works. So there is already some skeleton of what's there, but it needs to be built to know that this is the kind of service and the quality that you need to provide. And in terms of healthcare, you're not going to be driven by the profits that you make off a small service, but maybe economies of scale. If so many people are paying into it, then the profit will come. But the intermediary is really the financing mechanism, and that's the insurance bit. Yeah. Because to protect the individual from the profit margin that the private sector person is going to make, the intermediary is pulling the risk. And that's why health insurance is important.
All right, very interesting. So we are talking about a day that is happening tomorrow, the 12th of December. So as we walk into tomorrow, what should we expect from the non-government organizations, like the ones that you are representing? I'll start with you, Doctor. What have you put in place to ensure that you work with the government vis-a-vis the private sector to actually achieve this?
Our role as non-government organizations is to really provide a neutral eye and to be brutally truthful with government and all actors that we are not getting there when we need to get there. The other thing is we also contribute to development of the health system. Yeah. So what we want to do, or what we do, is to make sure we do it differently in ways that can be adapted by government and other actors.
How different?
Differently is because we introduce innovations, for example. Okay. Like at AMREF, we do innovative training using technologies that is much cheaper than using workshops in hotels. We do research and provide evidence and information. We advocate, like being here. I'm not here just on TV. I'm here to convey a message that I think we need to do things differently. And that's why I'm talking about national health insurance. We need to put it off the shelves and pass it as soon as possible so that we get alternative financing. We have models of public-private partnerships that government can even also look at or support and accelerate. So that's as non-government organizations, civil society in health, or health development partners. This is what we do, and this is what we bring on the table.
All right, all right. Doctor, what is coming in from your side? What have you put in place to help government walk the talk?
We are working with AMREF and several other partners in a partnership called the Health System Advocacy Project. Okay. The whole purpose of an advocacy day such as UHC Day tomorrow is voice. It's an advocacy day. It's not a day when we are going to, it's a day where we are going to really highlight the demand, those of us who are on the demand side. What do we demand in terms of getting access to services to quality services? What do we demand in terms of getting fair financing to support those services? What are we doing to demand for supplies and commodities that are required to support services? And the fourth area, which we usually demand in UHC are just those four components that I've gone through. And the fourth area is to ensure that we have social safety nets that ensure that families that do happen to go into poverty or otherwise, for one reason, if you are fired from your job or whatever it might be, there are mechanisms to take care for the indigent. That these demands are well articulated, but at the same time, it is a day on which the supply side must highlight, showcase what is being done in order to meet these demands. This is the day when we all urge governments, urge the UN, urge the supply side to respond to the demand. That's the purpose of this day.
All right. So besides, talking and pushing and requesting and demanding, for some of these policies to be implemented, is there any other system you have in place to maybe create adequate, checks and balances for all the stakeholders' interests in this case?
You notice we made a disclaimer earlier that Ministry of Health is not here. Government is not here.
In this case, I'm looking at the NGOs.
Yeah, NGOs. We also use such days to reflect and say, are we doing the right thing? Are we reaching the targets that we've promised the people of Uganda to reach? And every time we start on something, like I said, on a project, a partnership like this one, we have some promises that we are making, that we are going to demand, we are going to create improvements, and we use such a days to reflect. So as a health development partners, we commit to achieve our mandate to the people of Uganda, and on such a day we reflect to see whether we've arrived there, and we think about new strategies on how we are going to reach the goals that we want to reach, and how we are going to help a government, for example, to arrive at the goal they wanted to, perhaps sooner or even better. So for us, every time we are looking at where is it not working and how can we do it better, and how can we help government to get there.
But is government listening?
I wish they were here to speak for themselves.
Well, going by the response you get,
but I must say that government, especially the Ministry of Health, listens to us.
Okay.
There are quite some different arenas, working groups that we work in as NGOs, and where we contribute. The challenges that are also affecting Ministry of Health, for example, may be challenges that come from Ministry of Finance. And from Ministry of Finance, they might find they are not raising the tax they need to. So it's multifaceted.
Yeah.
It's multifaceted. But we also speak to the community, because, as you mentioned, we don't only say government must do this, government must do that. As citizens, we have a responsibility, although we have rights as well.
All right.
Yeah.
Okay. So, Doctor, as we are sharing tomorrow as a country, what would you expect from the public? How should Ugandans that are watching right now usher in the UHC Day tomorrow?
I think this is the day when everybody, wherever they might be, needs to reflect. Reflect on available information on what is required for us to move towards equity in health outcomes. The public will be assessing what information has been put to them. The role of civil societies as ourselves is, one, to produce the evidence and information, two, organize the debate, three, bring all the stakeholders together on days such as tomorrow to debate in a fair debate with a symmetry of information, so that they are able to reflect together on how they are going to go through the next year before the next UHC date, and say, this is what we have now, and looking forward, this is where I would like to be going. That's the debate that is on the table for tomorrow.
All right. Is it about time we also went back to our national health strategies and we need to do some bit of editing, or they are okay the way they are? We simply have to focus on implementing, like you said, because this is something that was adopted by all the countries. We all laid down national health strategies. We have our own, 2016, 2020. But is it okay in its current form?
Fortunately, I am privy to information that the Ministry of Health will be conducting a review of the National Health Development Strategic Development Plan that we are currently running. And it's going to be happening between, actually the review, collection of information and the reflection you're talking about is already starting. And by maybe somewhere in June or July, when there is a joint review mission, the government will be looking at, or ministry will be looking at that strategy. So that's going to happen anyway.
Yeah.
And this is the kind of input that is also required.
Yeah.
But my appeal to the citizens is that on a day like this, you need to check whether you've done your blood pressure, whether you've taken an HIV test, whether you've saved for the rainy day or the problematic day in terms of health. As a citizen, you need to reflect and say, okay, am I covered? If I'm not covered, where are those risks? And how can I be better prepared? Yeah. And the one thing that I find very interesting here is, like we mentioned, on your way to work or coming back and on a border, do you request for a helmet, for example? Are you protecting yourself from those kinds of injuries?
So before we ask for more, let us take what we have.
Exactly. Even the citizens need to do something to protect themselves or to cover themselves with health, so to speak.
All right, very interesting. Dr. Patrick says the citizens have to play a role or two in ensuring that they are healthy. Dr. Kadama, what do you have to say?
Well, I agree with him. I do agree with him. But let's go back to the fundamental. UHC is about policy instruments. And if the instruments are failing, regardless of players, we have a problem. We must give real focus. He has just said an important thing, that there is a review in the offing. I don't know much about it, but the ministry is not here to enlighten us about it. But we must critically understand whether it's the policies that are wrong or it's the implementation which is gone wrong. Otherwise, we'll be making policies every day, just going on and review. This is a very new plan. It's hardly 2 years. It is hardly 2 years. So what's gone wrong here? Let's be very critical about this. But it is clear there is a huge implementation gap. We have not done what we said we wanted to do, even with the little we have.
Why is that, from your own perspective?
From my own perspective, again, I have put it on a leadership failure. Implementation gaps are due to leadership failure. They are not due to competence. No, you have not put together the resources that you have been given to do the work you agreed to do.
Is it an issue of priority, or do we not understand how important this is?
Even if you have priorities, but you are not doing what you agreed to do, then that's it. If you say we shall allocate 15% of the health budget of the national budget to health, and you are allocating 6%, of course, even if the villagers went and jumped in the lake and bathed every day, we have failed to do what we agreed to do.
But is it an issue of priority, or simply do not have these resources?
You can call it priority, actually, because if we agree on something and you go and change that priority, it is an issue of failure of priority implementation.
Well, Doctor, what's your take?
Yeah.
Priority, lack of resources?
For me, the people charged with this responsibility, the leadership, should actually stand up and say, this is the time to do it. We have examples where Uganda puts energy, we really achieve. In health, we've had very good examples with HIV. We moved from 30% to the 6.7% right now. How did we do it? It wasn't just money lying in banks or money being thrown around. The leaders who took up that have arrived, and they did that. We've had examples like Ebola. When we put our energy and we focus on things, we do them. But there are those things.
But only after you have an outbreak, and there's plenty of callings, from all the sides.
Yes. So what we need to do is let the people in these positions stand up and say, now it is time to get 15% of the budget to healthcare.
Yeah.
And once it's done, then challenge those who it has been given that you're not doing the right job. And then that you will see what the difference will be.
All right. Thank you very much. Now, tomorrow will be the Universal Health Coverage Day. And of course, plenty of calls have been made by both gentlemen that I have in our studios. Yes, there's so much that has to be done by government. But Dr. Patrick Tumusiime rightly put it. He said that, yes, as we wait for government to implement the beautiful policies, by the way, that we already have in place. What have you done as a person? You know, what have you done to ensure that you are healthy? The private sector, yes, you are playing a very important role. But are you going as per what is needed to actually ensure that we have inclusive health access for all Ugandans? Dr. Patrick, I actually have two Dr. Patricks, you know, in studios. I actually have to use their surnames in this case. I'll start with you, Dr. Patrick Kadama, to get your very final remarks. And in this case, I will look at, you know, three stakeholders. I'll look at to government, I'll look at the private sector, and to the community.
And I think the key thing we need to address here, first and foremost, is to ensure that we have good public policy programs that sensitize our people to their responsibilities, and we adequately resource their implementation of those policies. At present, I think we are not moving towards that direction. Right. And as I said, UHC is a leadership issue, and the people who are being led are waiting. But it's a policy, a set of policy instruments to ensure that you are managing the disparities in society. In my view, disparities in our society in Uganda are not going down, they are simply getting wider. And this is a matter of concern. UHC must now be taken as a priority by our leadership to ensure that we manage this inequality that is beginning to emerge once more.
All right, thank you so much. Dr. Patrick Tumusiime, could we get your final remarks to all the stakeholders in this case? Let's start with government.
Yeah, my appeal to government is implement the policies and the commitments that you have signed up to. That will be, going that mile will be just enough for the people of Uganda.
Yeah.
Private sector, we're appealing to you to join and invest in health, not just as providers, but people who give information, people who mobilize, who sensitize, because the returns on your businesses as private sector are on a healthy and productive society. So I encourage the private sector to join the campaign to arrive at universal health care. The community, do your part. Individuals, protect yourselves, see what risks are there, and save for the rainy day, save for health, so that you're not driven into poverty when you get these emergencies that happen and usually do not go affect families very badly. Right. So that's really my appeal.
All right, thank you so much, Dr. Patrick.
Thank you.
It's been a pleasure. Dr. Kadama, thank you so much.
A pleasure.
It's been a pleasure. And to the viewers, thank you so much. Well, the UHC Day will be happening tomorrow. And yes, but simply get to ask the right questions. And of course, you can only ask the right questions if you know what you are asking. And that's where actually Dr. Patrick Kadama said that, hey, we need to know what universal health coverage is. We need to know what it is all about. We need to know what the United Nations has put in place. We need to know what the United Nations says government should put in place. And of course, the moment we are aware of this, we will be able to assess how we are faring as a country and be able to hold someone somewhere accountable. My name is Doreen Kumhanch. This brings us to the end of our discussion. Be sure to catch a lot of these and so much more, same time, same place. Good morning.